Hello, I am Ernie Elemento, and I am the Administrative Director at the Southwest Cancer Center at the University Medical Center Health System in Lubbock, Texas. And I'm here to talk with you on behalf of the SWCC's education program entitled the Financial Information and Learning Network for Community-Based Cancer Programs. Today I'm speaking about a topic that most of us have faced, and that is dealing with patients without legal immigration status, commonly named undocumented immigrants or illegal aliens. This patient population presents the cancer care team with additional challenges, but there are some strategies that I'd like to share with you in managing these patients. According to the U.S. Census Bureau, an estimated 11.2 million undocumented immigrants were living in the U.S. as of March 2010, a figure equivalent to 3.7% of the nation's population. This estimate includes persons who entered the U.S. without valid documents and persons who are living outside the terms of their entry visas. Of these undocumented immigrants, it's estimated that 3.5 million are migrant and seasonal farm workers. Except for some emergency care, undocumented immigrants are ineligible for most federally funded health insurance programs such as Medicare. Their access to health care is shaped by several policies and programs at the federal, state, and local levels. The undocumented immigration population is disproportionately male, and between the ages of 18 and 39, 35% of the undocumented immigrant population in the U.S. It's important to remember that undocumented immigrants live in every state and are concentrated in a relatively small number of states, reflecting the availability of work and social networks. About half of this population lives in one of 4 states: California, Texas, Florida, or New York. Nearly a quarter, around 23%, lives in California alone. Some states, such as Georgia and North Carolina, where relatively few undocumented immigrants resided 2 decades ago, have seen significant increases in the number of undocumented immigrant residents in recent years. Dealing with undocumented patients is a challenge, but here at UMC, we've developed a few strategies that I want to share with you. When a cancer patient presents to the Southwest Cancer Center, it becomes an organizational process because of the resources that are necessary to care for these individuals. On a weekly basis, there is a managed care meeting that occurs. It's a multidisciplinary team involving the CEO, the COO, the Chief Medical Officer, representatives of the Southwest Cancer Center, myself, and a couple others, and a few other primary care physicians, internal medicine folks, and family care practice folks. The goal is to individually assess these patients to figure out what the best way is to care for them. There are 2 options that we present to undocumented patients at the Southwest Cancer Center. If patients qualify for pharmaceutical reimbursement programs, those programs will be pursued. If not, then we give them 2 choices. They can either be self-pay, and if they choose that route, then they choose to receive their care at the Southwest Cancer Center. The other option is for them to initiate their care at their country of origin. The Southwest Cancer Center assists patients return to their country of origin by helping fund the transportation back and even fund the initial care that they will receive when they get there. The Southwest Cancer Center also sends members of the team during their transportation to make sure that they are received well and that proper instructions are given to the country of origin. If patients decide to do the self-pay route, the Financial Assistance Office will visit with them and do even more screening to look at income level so that a comfortable payment program will be established. It is important for undocumented patients to visit with the Financial Assistance Office so that they can investigate all the options and so that they can fully understand what their financial responsibilities are. As a county facility, the Southwest Cancer Center strives to provide the best possible health care while remaining good stewards of our limited resources. Whatever state your center or practice is located in, chances are that you will be faced with managing the diagnosis and care of the undocumented patient. It's important to have in place policies and procedures that your cancer care team can refer to when an undocumented patient enters your facility.